Your legs will not settle, not pain exactly, an uncomfortable, creeping restlessness that builds when you sit still in the evening and eases the moment you get up and walk. That pattern has a name, restless leg syndrome. It is a genuine neurological condition, not fidgeting or nerves, and the most useful thing to know is that one common cause is easy to test for. Doctors recognize it by a specific pattern, an urge to move the legs, usually with an unpleasant sensation that starts or worsens at rest, is partly relieved by movement, and is worse in the evening or at night. All four features together are what separate it from ordinary aches or cramp. Unlike a cramp, a muscle is not seizing. Unlike simple stiffness, moving genuinely helps while you are moving. It affects a meaningful slice of adults, more women than men, and often runs in families. And it wrecks sleep, not because of pain, but because you cannot stay still long enough to fall asleep. Here is the part worth acting on. Restless legs is strongly linked to low iron stores in the brain, and blood ferritin is the marker doctors use. Crucially, your ferritin can sit inside the normal range and still be too low for this purpose. Sleep specialists commonly look for a level well above the bottom of the reference range before they are satisfied. So the single most useful step is a blood test for ferritin, and a conversation about the result rather than a glance at whether it was flagged normal. If it is low, treating that can improve symptoms substantially. Several everyday things aggravate it. Caffeine late in the day, alcohol in the evening, and nicotine are the usual suspects, and they are worth testing one at a time rather than all at once. Some medications can trigger or worsen it too, certain antihistamines, some antidepressants, and anti-nausea drugs among them. If symptoms begin after a new prescription, that is a conversation to have rather than a coincidence to ignore. Sleep deprivation makes it worse, which is the cruel part. Bad nights feed the condition that caused them. Movement is the reliable lever. Walking, stretching the calves, gentle cycling of the legs. Anything that gives the system the movement it is demanding before you lie down rather than after. Warmth or cold applied to the legs helps some people, and it is worth finding which one works for you rather than assuming. Massage before bed helps others. Pneumatic compression and moderate regular exercise both have supporting evidence. What does not help is intense exercise late at night, which tends to make the evening worse. A workable routine looks like this. Keep caffeine to the morning. Move deliberately and the hour before bed rather than sitting through the built-up. Stretch the calves properly and give the legs warmth or cold if that suits you. Then keep the bedroom cool, and accept that on a bad night getting up to walk for a few minutes is more useful than lying there fighting it. None of this is a cure. It is symptom management, and its purpose is to buy you enough calm to fall asleep. See a doctor if symptoms happen most nights, disturb your sleep, or are getting worse. Ask specifically for a ferritin test and ask what the number is. Medication exists and helps, but it belongs in a doctor's hands. Some drugs used for this can cause symptoms to intensify over time, a phenomenon called augmentation, which is why self-treating with someone else's prescription is a bad idea. And if the sensations are in one leg only, or come with weakness or numbness, that needs assessment rather than a routine. I built a small app for the evening routine, RestCalm. It guides a short sequence of leg stretches and movement before bed on a timer and gets out of the way. No ads, no subscription, no account. The link is in the description. Do the routine, get your ferritin checked, and treat this as something with a real cause rather than a habit you need to break.